You are watching the news from the Sultanate of Oman television. First, the headlines. His Excellency President Abdel Fattah al-Sisi of Egypt is to start an official visit to the Sultanate from Sunday, the 4th of February. The Oman International Nephrology Conference starts in Muscat. And as per government directives, the Petroleum Development Oman stresses that in the future it will manage non-oil projects in the Sultanate. Those were the headlines. Now for the news in detail. His Majesty Sultan Qaboos has sent a cable of condolences to the custodian of the two holy mosques, King Salman bin Abdulaziz Al Saud of Saudi Arabia, on the death of His Highness Prince Mohammed bin Abdul Rahman bin Masad Al Saud. His Excellency President Abdel Fattah al-Sisi of Egypt will pay a 3-day visit to the Sultanate starting from Sunday, 4th of February. The visit came to enhance the cooperation march between the Sultanate and Egypt and support the joint interests between the two sides in various fields. His Excellency, the Egyptian President, will be accompanied during his visit to the Sultanate by a number of senior officials. A 3-day Oman International Nephrology Conference began last night under the auspices of His Excellency Dr. Sultan bin Yarab Abu Saidi, Advisor for Health Affairs, Ministry of Health. More details in the following report by Abdullah bin Ahmed Al-Rubai.
The scientific sessions of the first Oman International Nephrology Conference organized by the Nephrology Department at the Royal Hospital commenced last night. This remarkable event brought together over 270 kidney specialists will allow them to get in touch with the latest advances and innovations and exchange ideas by the national, regional and international eminent speakers and researchers from 3 continents, thus reaching the objectives of upgrading the participants' scientific level in nephrology, kidney diseases and transplantation.
Being aware of the presence of kidney disease is important because this will permit early treatment. And early treatment is associated with better response and control of the disease rather than rapid progression or rapid worsening of the disease. Also, of the purposes of this Congress is to there's an elite of experts in different fields of kidney diseases are invited to give us the new trends and the new treatments in kidney diseases, so that again we can start the treatment early and properly. Early and proper treatment will help in controlling the disease and to reduce the progression, the worsening of kidney diseases.
The main message is that kidney disease is much more common than many people realize. People think, when they think of kidney disease, they often think of severe kidney failure, which requires dialysis treatment or a kidney transplant, and that's very important. But there are many people with other less severe forms of kidney disease which matter because they affect your health. So, for example, many people who have some chronic kidney disease actually have much higher cardiovascular risk. They're more likely to die of a heart attack or a stroke than their neighbour. So the message we want people to understand is that kidney disease is common, it's there. It should be thought about by your physician and your nurse who look after you, as well as by you and your family. And that luckily there are some simple things which can be done for people with early kidney disease which can make a real difference. Simple tablet treatments to control blood pressure, simple reduction of salt in your diet. Those are things which, if you have a kidney problem, can help to make it less severe. So there's lots you can do about it when you know you have it.
The aim of this conference is to increase the awareness of the kidney diseases in the country and for the doctors to pick it up early so that the patients don't reach to us at the end stage when there is not much which we can do except dialysis. The whole idea is to prevent the disease before it's too late.
Chronic kidney disease is a global problem as the number of patients is on the rise. In the Sultanate, there are more than 1,500 patients on hemodialysis and 190 on peritoneal dialysis. Majority of them are young. It's worth mentioning that major cause of end-stage kidney disease in Oman is diabetes mellitus that represents more than 46%. Abdullah bin Ahmed al-Rubai, Sultanate of Oman Television.
Petroleum Development Oman stressed that in the upcoming period it will manage non-oil projects in the Sultanate. Raul Restucci, Managing Director of PDO, said that the company will focus heavily on the renewable energy sources which are compatible with the government's directives to diversify sources of income. Restucci's statement came during the signing of an MOU with Qatar international company Ostath on the cooperation in implementing some infrastructure projects in the Sultanate. Omani oil price April delivery reached $67.31 per barrel. Dubai Mercantile Exchange stated that the price of Oman oil today increased by 91 cents compared to yesterday's price, which reached $66.40 per barrel. The average price of Oman oil February delivery amounted to $61.60 per barrel, increasing by 81 cents compared to the price of January delivery. Oman National Transport Company Muwasalat today launched the Muscat-Barka route. The launch is to meet the needs of the passengers for operating a direct route from the Governorate of Muscat to various wilayas of the Sultanate, especially to facilitate the travellers during official working time. Under the auspices of His Excellency Dr. Sultan bin Yarab Abu Sayyidi, Minister of Health's Advisor for Health Affairs, the Directorate General of the Royal Hospital and the Omani Association of Anaesthesia organised the second conference on enhanced recovery after Cesarean section. More details in the following report by Abdullah bin Ahmed al-Rabai.
Over 160 healthcare staff representing various healthcare institutions in the Sultanate are attending a one-day conference on enhanced recovery after cesarean sections known as ERACs, which focused on principles of ERACs and its benefits in reducing the complications and decreasing the length of stay within hospital premises.
This meeting is being held for the second time in Oman. Enhanced recovery after cesarean section is a new concept in Oman, and the aim of this meeting is to develop guidelines and protocols. Enhanced recovery after surgery are clinical pathways aimed to reduce complications, improved outcome, and reduce hospital stay, and invariably reducing cost. And I'm very pleased to see about 160 healthcare professionals from all hospitals in Oman participating in this meeting, which will have a great impact on developing and advancing the healthcare services in the Sultanate.
According to the Ministry of Health annual report, cesarean section it has been increased from 9.7% in 2002, and it reached up to 19.5% in 2016. That's why we are here today to implement early recovery for cesarean section.
One of the aspects of ERAS that we focused on are the medications, as some medications can be overly prescribed. And one of the most important objectives of this ERAS is to minimize those using these medications. And also we focused on nutrition, that the patient who has undergone cesarean section can tolerate food, can eat food as soon as possibly she can, but this needs to be monitored by a nutritionist.
The idea is to dramatically improve the care of the patient before, during, and after the operation, and this will lead to minimizing the complication and getting the patient to come back to normal a lot quicker after her cesarean section, and at the same time improving the patient experience and patient satisfaction.
It's worth mentioning that according to the Minister of Health's report, since 2012, there has been an increase in cesarean section operations in the Sultanate of Oman, and this has resulted in more hospital admission, increasing length of stay and increased complications. Furthermore, the overall percentage of cesarean section in Oman since 2012 has been deviating away from WHO guidelines, which state that the percentage of cesarean section from all deliveries must be less than 15%. These figures clearly indicate the importance of establishing a standardized protocol for implementing the principles of Iraq's in these cases. Abdullah bin Ahmed al-Rubi'i, Sultanate of Oman Television.
Still to come in our news bulletin. The Lionesses in the Dallas Zoo picked the Patriots to win the Super Bowl 52. A military parade was held in Russia's city of Volgograd today to mark the 75th anniversary of the World War II Stalingrad battle. The parade took place on a square in the centre of the city. Military commanders greeted parade participants on cars, and representatives of many different military units marched with banners and weapons. The battle for Stalingrad was one of the biggest in the history of the Second World War and is believed to have paved the way for victory over Nazi Germany. Dallas Zoo says its Lionesses are picking the Patriots to win Super Bowl 52. Aunt Jasuri and 10-month-old Bahati went straight for the Patriots' meaty ice cake yesterday. Later, Bahati's mother Lena tried to drag away the ice cake with the Eagles' colours. Bahati is the first lion cub born at Dallas Zoo in 43 years. Animals at Dallas Zoo have correctly picked the winning team in the last 3 Super Bowls. Now for the general weather forecast around the Sultanate. Clear skies will prevail over the Sultanate, with chances of low clouds and fog late at night and early morning over the governorates of Sharqiya and Worcester and coastal areas of the Sea of Oman. Winds will be southerly to southeasterly, light to moderate. Seas will be slight with a maximum wave height of 1 metre. This is the Sultanate of Oman television. Before we end tonight's bulletin, here are the main points once again. His Excellency President Abdel Fattah al-Sisi of Egypt is to start an official visit to the Sultanate from Sunday the 4th of February. The Oman International Nephrology Conference starts in Muscat. And, as per government directives, with Petroleum Development Oman stresses that in the future it will manage non-oil projects in the Sultanate. With that, we come to the end of tonight's news bulletin. From all of us here at the newsroom and the studios, it's good night.